Patients about embryo transfer and disposition in general are complex and impact both providers and patients. In this video, we will present 3 key points discussed in the ASRM Ethics Committee opinion on compassionate transfer, published in the January 2020 issue of Fertility and Sterility. These points are defining compassionate transfer, understanding the ethical considerations, and policy creation. Let's begin with defining compassionate transfer. An embryo transfer for non-reproductive purposes is often called a compassionate transfer, to reflect a provider's benevolent empathy in facilitating a patient's desired method of embryo disposition. The ASRM Ethics Committee adopts the term compassionate transfer to describe embryo transfer when pregnancy is not intended, but also acknowledges it is not a term of exclusion. Provider compassion toward patient choices is certainly not limited to requests for non-reproductive embryo transfer. Next, let's discuss ethical considerations. Valid and reasoned arguments exist to support provider decisions to perform the compassionate transfer for embryos for non-reproductive purposes and to decline to assist in such transfers. Principles of reproductive liberty, physician autonomy, medical futility, non-malfeasance, and distributive justice are potentially invoked in decision-making in this area. Lastly, let's talk about policy creation. Patient requests for compassionate transfer should be regarded the same as patient requests for embryo transfer for reproductive purposes as far as matters of consent are concerned. Programs should develop explicit written policies and procedures for handling requests for compassionate transfer of embryos, including requirements for written informed consent, and make those written policies available to all patients. To review the full Ethics Committee opinion, please click on the link at the end of this presentation. Thank you.